Hi, I'm Scott DeBoer. I'm one of the flight nurses from University of Chicago, and I'm also the founder of Pizza R Us Medical Education. And welcome this afternoon to our Backup Airway Buffet. Now, when it comes to intubating kids, the moral of the story in my experience is relatively simple. If you intubate kids all the time, great. Your success rate is probably going to be really good. If you don't intubate kids on an everyday basis, having some sort of a backup airway to play with, I absolutely believe is where it's at. Now, when it comes to backup airways, whether you're a paramedic or nurse or an RT, there's pretty much 3 different airways out there beyond the combi tube that we play with when it comes to kids. My personal favorite is the King Airway. The reason I like the King Airway is a couple-fold. The first of which is all you have to do is take a look at the airway. And if you see that right here is the trachea, the big hole that's in the back is the esophagus. With the King Airway, all you have to do is open your mouth, essentially, and shove it down. And when it doesn't want to go anymore, you inflate it. And once it's inflated, one balloon is going to go ahead and close off the esophagus, the other of which closes off the top of the airway. And air goes to the only hole left over, which is happily into the lungs. The other reason that King Airways are nice is that currently in the United States they go 2-year-old all the way up to big people. However, in the very near future, they're also introducing the baby and the 1-year-old as well. Meaning now in less than 5 seconds, you can blindly shove this tube down and begin to bag. Now the other options involve some variation of an LMA. And whether it's a traditional LMA, which looks like this, an LMA, you remember, is laryngeal mask airway. Laryngeal means larynx, mask means mask. So when these are inserted, you go ahead and the same idea applies. Once you pick the appropriate size, we slide it down to where it needs to be. And once it's inflated, it will go ahead and close off the esophagus. And air, much like the King, goes into the only hole that's left over, which is happily into the lungs. And when it comes to sizing of LMAs, the smallest disposable, meaning one-time throw-it-away LMA, goes down to a 1 kilo or 2 pound baby. Now, the last toy relatively recently introduced in the United States is over here, and this is the Igel. And the Igel looks like an LMA because, at its heart, it's an LMA. And it's inserted just like an LMA, meaning you open your mouth, and once you know the technique, you slide it down. Once it's in place, air will again go to the only hole left over, meaning into the lungs. Sizing, pretty much the same as with the traditional variations of LMAs. But the difference is when you play with an Igel, you notice that it has no cuff. That's because it's made of a silicone-like material, and once it's actually in place, you have no need to inflate anything, meaning whether it's a regular King, an LMA, or an Igel, in less than 5 seconds, especially if you don't intubate kids on an everyday basis, you can pop one of these back airways down, you can bag, and when people have a whole lot more experience, and a whole lot more help, and a whole lot more time on their hands, then they can pull the back up and go ahead and place a traditional endo tube. So with that, this is your Pediatric Backup Buffet.